Hello, welcome to Mental Health Hour this Tuesday evening here in Ontario. It's great to be here. It's great to have this platform where we can talk about our mental health. My name is Dr. Tapo, and you are listening to the Mental Health Hour on Love Bay Radio. Please get in touch, connect with us as we're discussing depression today. We've been talking about it for a couple of weeks now. Send in your questions, send in your comments, share some of your own experiences, seeking mental health support, getting treatment, getting diagnosed, maybe for you or your loved ones, but get in touch during the mental health hour. So just a bit of a disclaimer, Mental Health Hour is for education and information only. We're raising awareness, we're educating each other so that we can make informed decisions about our mental health and our health care. My being here does not in any way mean you should not go and seek the help that you need. Please, like I always encourage, in your city, in your town, in your country, get the help that you need from a qualified practitioner. It could be a therapist, it could be a physician, it could be a psychiatrist, it could be a clinical counselor, but make sure whoever it could be your pastor or counselor from church or from your mosque, but make sure that they are equipped and capable and have the capacity to support you as you get help for your mental health. So get in touch, 437 77. Okay. I really thought I had it this week. So call or text, email infolovebay@gmail.com, infolovebay@gmail.com. And if you're texting, you can text 437 778 3299, 437 778 3299. I don't know if I'll ever get this without needing to look at it. I've been doing this mental health hour for several years. The number has never changed, but for some reason, I just cannot say it from memory. So 437 778 3299. You can text iMessage, you can text on WhatsApp. You can also email infolovebay@gmail.com. So please do get in touch. Let's talk about our mental health. And as I said, we've been talking about depression these last couple of weeks. We started off talking about stress. We talked about anxiety and other mental health diagnosis like PTSD. We talked very briefly, I'll say, just a little bit about conditions that might be related to stress, depression, and anxiety, like chronic fatigue syndrome, like PTSD. We've even talked a little bit about conditions like, I think it was a mental health hour anyway, bipolar, because sometimes people get confused. Is this bipolar or is it something else? So there are a number of conditions, like I said last week, that have a lot of the same symptoms. So if you look at the symptoms I described for stress, for anxiety, for depression, for even panic disorder, some symptoms for PTSD, those symptoms are so similar. All the symptoms are so similar. And that's why I was saying last week, do not self-diagnose. Do not self-diagnose. Don't think, well, Dr. Tapo or Google said it's these symptoms, so I definitely have depression or I definitely have anxiety. It actually could be something else. Or you might think, no, it's just a little bit of stress because I'm going through a hard time right now. Once that hard time is past, I'll be fine. Don't do that. Do not do that to yourself. As soon as you notice some changes, in your appetite, your mood, your even how you're socializing and relating with other people, any physical pain that you really can't explain. But even last week, I was saying, even if you can explain it, even if you know exactly what it is, still go and get the help that you need. Still go and get properly assessed and diagnosed and offered treatment. And I'm saying offered treatment because you don't necessarily have to take it, right? We all have our free will. But the first and most important step to great mental health, to recovering even from mental health episodes, is that you get the help in terms of diagnosis, in terms of treatment options, in terms of even education and understanding. Most physicians, most psychiatrists, most even therapists will go through the trouble of educating you and ask all the questions you need to ask. Don't think like they'll think I'm dumb, they'll think I'm stupid, maybe I'm wasting their time. Listen, ask every question you need to ask so you can make an informed decision. I can't tell you enough how many times people have come to see me, and when I ask them, what did the doctor tell you? They don't even really know what their diagnosis is. Oh, yeah, I did go see the doctor. Yes, they did say something was wrong, but I didn't understand, or I can't remember what it's called, which is fine. I have a poor memory myself. Like, you've seen how much I've struggled with the number I've been saying for years at this point. But ask all the questions you need. You can also even ask them to give you some kind of report. So they might, unfortunately, depending on what they do, they might charge you a little bit extra if you say to them, can you print it out for me so I can go home and read and understand? Some places will print it out, no problem. Some places will say, well, our ink, our paper, our administrative fee, and charge you something. Most, like here in Ontario, you can now access your medical records online. So all like the public health systems are hooked up. So when I go to the hospital, I can actually go into my record, see the tests that the doctor did, what did they diagnose me, what did we discuss, when is my follow-up. It's all there online. And I know not all of us are tech savvy that way. And unfortunately, not every general practitioner or your primary care physician will give you access to that. But actually, you have a right legally. You are entitled to your medical records. So no one can tell you no. No one can tell you no. And I'm not even sure, actually, it's been a long time since I've heard of someone being charged for their medical record to be printed. Some, obviously, it's many, 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 many pages. Maybe you've been going to that doctor for 25 years, and then you're saying, can I have my medical record? And they're thinking, does this person want us to print 25 years of doctor's visits? Believe it or not, you have a right to that information. No healthcare provider can say to you, no, you can't see your record. And if you're a legal guardian, so if it's your child and they're of a certain age, as their parent, as their legal guardian, you can also request their medical records. So go to the doctor, get a proper diagnosis, ask all the questions you need to ask. Understand if they say to you, okay, we're going to put you on this medication, ask all the questions. What are the side effects? How long can I expect before I start to see a change? Sometimes, and I've said this previously, sometimes people think, oh, they put me on medication today, by tomorrow I should be okay. And it doesn't work that way. It takes a while, right? But ask all these questions so you know what to expect, so you are prepared. Sometimes some medications will knock you out. Like you can't go to work, you can't drive a car, you can't use a knife safely because it's new to your body, you're just introducing it. I've had clients, their physician put them on antidepressants, and they found for the first week they were sleeping 18 hours a day. They just couldn't do anything. But by the end of week 2, it had started to normalize, and they were able to now start going back to work. It might be a while before you can drive or operate heavy machinery. I have to really, really stress this. Please, for the love of everything mental health, if you start on medication, do not drink while you're on medication, especially when it's new in your system, because you don't know what might happen. No alcohol, stay away from alcohol. No marijuana, stay away from the wacky tobacco. Like, stay away from those things, especially when you just started on new psych medications. Just do not mix with alcohol, do not mix with other drugs. And often the physician will ask you, are you taking anything else? Because that medication mixed with something else might be a cocktail of disaster. So don't do that. Do not do that. Stay away from anything that, even without medication, is going to alter your judgment, your alertness, your risk aversion, right? Because sometimes some of these things that we drink and ingest, they make us feel like we're invincible. And then on top of that, you're now taking psych meds. Really, 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 really terrible idea. Do not do that. So if you're new on medication, stay away from anything that could react really, really badly with that medication. Okay, so that's just a summary of some of the things that we've talked about so far. So you can text 437-778-3299 if you're listening. You can text on WhatsApp. You can text on iMessage, I think, as well. The country code for Canada is 1. So if you're texting from outside the country, please just remember to put the country code first. Okay, and you can also email infolovebay@gmail.com. So last week we had a few people write in, ask their questions and that, and I missed one of those. So we're going to go into that before we go any further. So this was from Cheryl here in Ontario, and Cheryl wanted to know, she said, I'd like to know if one is taking marijuana gummies. So those are edibles, right? We have gummies, we have cookies, we have even I've seen pop, like soda, like juice that is enhanced with marijuana. So she's basically saying if somebody's taking marijuana gummies, so that's the candy, to help with sleep and anxiety, can this lead to one becoming addicted? I was told by my child that this is what she does to cope with her anxiety. And that's a really, really good question, because remember what I said last week. There's this myth that you can't get addicted to marijuana. And I'm telling you, that is not true. It is absolutely not true. If you can get addicted to ice cream, if you can get addicted to chocolate, if you can get addicted to sex, to TV, to video games, why do you think you can't get addicted to marijuana, which works directly on your brain and the functioning of your brain? And I told you about a young woman I worked with some time ago. She'd wake up in the morning and she can't do anything without first having a joint. She has to smoke first to be able to feel she can go about her day. And she couldn't sleep without going about her day. And sadly, Cheryl, it started with edibles, because what happens is your body builds a tolerance. It's like with alcohol. The first time you have a drink, a little drink like this can make you tipsy because it's the first time. By the time you've been drinking for, I've seen this. I've sat with people socializing who can put away 2 full bottles of wine by themselves in one sitting, 2 full bottles, and they'll still get up. They're not stumbling all over the place. No, they're still quite fine. They're having a coherent conversation. They can still do, but they've just put away 2 full bottles of wine. Now, think about the first time they had wine. Do you think they could have put away 2 full bottles? No. But because they've been doing it over time, their body has built a tolerance. And I was talking to you before about some people that have developed what we call alcohol dependence. These are not people that are having an ordinary Heineken or Carlsberg or whatever it is that you drink wherever you are in the world. No, these are people that wake up in the morning and the first thing they need is a whiskey, a vodka, something with high levels of alcohol. I have even worked with people that were finding ways to drink things that had up to 75% alcohol. I have seen this and I have worked with them because for a while I was working in addictions. And I guarantee you that it did not start that way. It's the same thing with marijuana. The more your body becomes accustomed to it, here in Canada, where marijuana is legal, I'll tell you this: stores are not allowed to sell edibles. So those are the things you ingest rather than smoke. They're not allowed to sell edibles with I have to make sure I think it's either 0.5% or no, 5. I will look it up and I will get back to you. But they can't sell edibles with a certain past a certain percentage of marijuana, right? So the gateway is edibles. People start with edibles. They have a gummy with only 2 milligrams or something like that, very small quantities. And that helps them to sleep, that helps them to whatever. But if you're doing this all the time, sooner or later you'll find that that is not enough. So you start taking something a little bit stronger, right? And then your body develops tolerance for that. So now even edibles don't do anything for you unless you've made them yourself at home and put in as much marijuana as you want. I have known people that are smoking the same way people smoke cigarettes. They're smoking joints throughout the day. They didn't start that way. But because they've built a tolerance, they're now doing it more frequently, more frequently. And they can't stop. And addiction is simply not being able to stop something when you want to. You no longer have that level of control where you can say, you know what, I don't want to do this thing anymore, and you simply stop. And I'll give you this. As a therapist, this is one of the lies people love to tell in therapy. And one day I'll do a show just simply on the lies people tell in therapy, because there are so many, and us therapists have heard these all the time and so many times, and we have come to understand like there's some lies people will tell. I'll give you an example. One of the things we assess, like I've told you, therapists will often do some kind of assessment so that they have a clearer picture of what it is. Now, a therapist here in Canada does not diagnose, but that doesn't mean we don't do assessments. We still do assessments, but we're not diagnosing. Okay. So we'll ask questions like, how often do you drink? So many clients will say, oh, I'm a social drinker. And then when you ask, what does that mean? Well, I only have like maybe per month 1 or 2 glasses of wine. And then the more you talk to them, you eventually discover they're talking about 1 or 2 glasses every night. They can't go to sleep without a glass of wine. But when we first started therapy, it was, I'm a social drinker. I'm sorry, who are you socializing with just before bed in your bedroom? No one. So you're now drinking this wine outside of social situations. Do not describe yourself as a social drinker, because you are not. And that's one of the first indicators that maybe you have lost control around your consumption of whatever that is, right? And so when we're talking about marijuana, what I'm saying is, you might start with that, oh, I just take gummy bears just to help me sleep. But if you do it frequently enough, it no longer has the same impact. So now you're going to up it. One of the first things I learned when I was training around addictions, because what addicts like cocaine, heroin, and all of that, and why they keep, the first time they do it, they're basically chasing the same experience they had that first time they did it. But they'll never have that again. It'll never be that good, that enjoyable, or whatever it is ever again. It's like the first time you have sex. You can try and reclaim your virginity a million times. The fact is, you had it once, which means you're no longer a virgin. And maybe it'll get better with time, depending on who you're doing it with. Anyway, my point is, often we're trying to recreate that first experience with a lot of these substances, with alcohol, with drugs, even with sexual addiction. That's what people are looking for. It's not simply about getting off. They're looking for a certain type of experience, and now they keep chasing that because they want to experience it the way they did that first time, or with that person, or whatever, or with that drug, or with that drink. And the more you're chasing this and not getting it, you're upping the doses, your behavior is getting riskier. That's why with sexual addiction, it might start as something very small and negligible. But if untreated, sexual addiction can lead to very, very, very dangerous behaviors. Why? They're trying to recreate that first experience. And that's what addiction is. When you find you've lost control, meaning you can't stop, when you find that you can't function as you normally would. So, you used to go to work every day, used to be able to earn an income, used to be able to hang out with your friends, and all of that. And I gave the example of somebody who now you're thinking, do I really want to hang out with these people if they're not going to be doing drugs with me? They'll judge me, they'll say I'm bad, they'll do this and that. So you start avoiding certain social situations. And the more you do that, you start to seek out people who are engaged in those same behaviors. And that's why you find with people that are struggling with addiction, they cut ties with everyone who's not in that lifestyle. And then they surround themselves with people that are. Why? Because those people are enablers. They're not trying to get them out of that life. And they don't have to deal with the guilt and the shame all the time. So I really suggest, if your child is taking marijuana, alcohol, whatever it is, And that's also what we call in the field self-medication. That is self-medication. I'm pretty sure she didn't go to the physician and the physician wrote her a prescription for marijuana gummies. The fact that she's doing this on her own is what we call self-medicating. So she's self-medicating. And that's something we would ask in therapy. Do you self-medicate, and with what? I would tell you, Cheryl, tell your child to go to the doctor. If they need sleeping aids, it's better to get a prescription from your doctor, because the doctor will be able to monitor it. But what you'll find is, even with prescription medications, they'll start off at a certain dose. But after a while, it has to be increased because it's not having the same impact anymore. Also, Cheryl, advise your child on things like mindfulness, on sleep hygiene, stuff like that, so that they can, the same way we do with babies. And this is something I've said to some of my clients who struggle with sleep. We train babies how to sleep, right? When they're first born, they're sleeping like all the time. I have one nephew, every time I would call, he's fast asleep. And I was like, does this guy do anything else? Happy birthday, Koa. He just turned 1 this week. But now he's a little bit older, but has a bedtime. So his parents will say, whatever, 8 o'clock, it's time for bed. They put him down. Obviously, when they first started that, it wasn't his routine. He'll kick up a fuss, he'll do this, he'll do that. But the more you carry on with that routine, it starts to feel natural. Your body starts to respond to that. So let's not be so quick to look for drugs, chemicals to help us to sleep. Try establishing a routine first, right? Because even with prescription medicines, it's not uncommon that you find yourself needing higher doses. Okay. So I hope that answered that question. We have a couple more here. Hi, Dr. Tapo. My son is on meds and he continues to drink and smoke marijuana. All attempts to get him to stop has fallen on deaf ears. What can I do? I'm scared. And this is from a listener in Las Vegas. It really is dangerous. It really, really is dangerous, because these are chemicals. Like, think about marijuana and think about alcohol as chemicals. And then you're on prescription meds, which is more chemicals. And these chemicals are all going into the same system. Your body will react. Your body will most definitely react. Some people do it because maybe their meds make them slightly high, and prescription medicines do that. Like, let's be honest and real about what the doctors give us. Some of them, like I said, can make us absolutely drowsy. Some of them can increase our anxiety. We get jittery. It's like when you drink coffee, that's the other thing. If you're taking medications that make you jittery, which means you can't relax, you're shaky, and then on top of that, you're drinking copious amounts of caffeine, your coffee, energy drinks, that's another one. A lot of young people like mixing energy drinks with medications, energy drinks with alcohol, energy drinks with like, do not do that. Because like I've said, all of this means your body has to process, has to keep up, has to protect itself. So you find, you might be saying, oh, I have anxiety, so I'm on this anti-anxiety medication. And at the same time, you're talking about, I smoke marijuana for my anxiety. Actually, research has shown marijuana increases the risk of anxiety, especially in young people. Especially in young people. So even though here in Canada and in other parts of the world, it's been legalized, knives are legal, guns are legal, poison is legal, but you don't allow your kids to indulge in all of that just because it's legal. Don't allow them to indulge in marijuana. We've also seen an increased rates of schizophrenia and other psychotic conditions in young people because of the use of marijuana. It is also one of the major reasons a lot of young people are struggling with their education, struggling with establishing careers, and even those normal young adult milestones. They can't do it because their life is being controlled by marijuana. So if you have a child who's on prescription medication, and like this listener in Las Vegas, and you're saying attempts are falling on deaf ears, I don't know if your son is an adult. It sounds like he might be. If not, and if he's a minor, maybe you can get the help of a physician, take them to the doctor, look for addiction resources, look for community resources that will help them with the addiction, if it's an addiction. But a lot of people will say having a few beers every evening or every week or every this is not an addiction. And what I would say is there are lots of assessments you can take. If you, like, for yourself, do some of these questionnaires, you will actually realize that what you thought was just me winding down is actually quite problematic. Because if you ever get sick and need to stop, you're not going to be able to. Not only that, you're probably spending money you don't have. Like, these things are not free, they're not cheap. You're probably spending money you don't have. So I would say if you Google alcohol dependence assessment or some of those keywords, do the questionnaire yourself and see where you stand. Be very honest with yourself. You can also share some of these things with your loved ones, like just take the assessment. If they're on treatment for anxiety, one question is, when was the last time they went in for a checkup with their doctor since they've been on that medication? And this is where people will go to their doctor and lie. Like, I don't know if it's just me, but I don't see the point of lying to your physician. They can't put you on timeout. They can't put you in jail. Like, you're not breaking any law. They're asking because their number one job is to help you with your health. And you're sitting across from them, lying through your teeth and not giving them an accurate picture. But you're the one who's sick. You're the one who will suffer. Right? So please do not lie to your therapist. Don't lie to your psychiatrist. Don't lie to your physician. There's no point. Like, there is really no point. Why lie to somebody who, like, really, 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 when it comes down to it, they have no authority over your life? You went to them because you're sick and need help, and then you sit there and you lie. And for me as a therapist, I can, like, part of my training is being able to tell this person is lying to me. There's some exaggeration, there's some gaps that they're leaving. I can tell because that's my job. Part of my job as a therapist is to read between the lies and to read you as a human being, not simply take everything you say. And as a therapist, I've been in different situations and contexts where people are lying to me, playing mind games and all of that. And I'm looking at them like, okay, they don't really understand what I do for a living. But since this is where they are at, I will meet them at that level. So I act like I believe what they're saying, but I know later on their problems will escalate. And then maybe they will be honest and maybe they will get the help that they need. So if you're one of those people, your doctor asks you, have you been exercising? You're telling them, yeah, I go to the gym like 3 times a week, and you haven't been in 3 years. Are you eating a balanced diet? Yeah. I eat like a plate full of vegetables with every meal, and you don't even know what spinach tastes like. Do not lie to your physician. It is the most, I'm sorry, stupid thing to do, because their one job is to help you. And they can only help you based on the information that you give to them. And the more lies you tell, the more you're sabotaging yourself. So be honest. Be honest in therapy. Be honest in the doctor's office. Be honest with your psychiatrist. And you know what? For those of you who have family and friends that genuinely love them and want the best for them, be honest with them too. Do not lie to people who are there for you, who can support you, who can help you. Okay. Another listener wrote in from Vancouver, says, I've been feeling sad, but not knowing what it is. I feel out of place and feel down. Is it depression? Okay, so back to what we were talking about last week, when we looked at some of the symptoms, which does include feeling sad, and you might not know exactly why, or sometimes you do know why. That doesn't mean it's not depression. Okay, you're feeling sad, maybe hopeless, numb, empty, restless, irritable, anxious, short-tempered. You're having difficulty concentrating, making decisions, remembering things, so your memory is also impacted. You have less interest, or you're not participating as much in things that you used to enjoy, which were normal for you, right? Lots of feelings of guilt and shame, feelings of worthlessness. And I said last week, like, do away with that guilt of, I should be happy because others don't have a roof over their heads, or some people don't have food on their plates and lights in their homes and whatever. So you start to feel guilty because you keep telling yourself you should be happy. The more you treat yourself that way, the more challenging it is to recover from the depression, because that guilt, that shame, those feelings of worthlessness, they compound the situation, they make it worse. And the longer you feel these things, remember I said, if you do a self-assessment and you find you've been feeling like this generally, that doesn't mean you haven't laughed or smiled in 2 weeks. Yeah, you probably have. You've probably even gone out or whatever, but it's when you come home and you're like lying in bed, and you know, while you are out there with your friends, most of it you are trying to fake it till you make it. And I said, this is why we're often shocked when people die by suicide, because we were looking at their outward presentation. They're happy, they're laughing. Look how successful they are. Look at the car they're driving. Look how much money they have. Look how they dress and all of this. And because this is what people are seeing of you, but deep down you know something's wrong, you start to feel guilty and unashamed and ashamed. Pardon me. You start to feel guilty and ashamed. Don't do that to yourself. Okay. So if these feelings, to our listener in Vancouver, if you've been feeling like this for about 2 weeks, go see your physician. Go see your physician. It's also a good idea, if it hasn't been 2 weeks or you can't remember how long, give yourself maybe a week of journaling or diarizing your feelings, and you can use different things. One of the methods one client of mine used, here we have the dollar store where you can buy stickers and stuff. They bought stickers. When it was a good day, they used the good day sticker. When it was a bad day, they used the bad day sticker. And at the end of the week, they were able to see what's been going on for them that week. So if you're not sure if that it's been 2 weeks or how long you've been feeling this way, because sometimes it kind of creeps up on you, right? And then you wake up now in crisis, or you become aware because you are now in crisis. But slowly, and this is why when I was talking to you about stress, I was saying, do not dismiss and ignore stress. Don't say it's just stress, it'll go away, or it's just, I'm just feeling sad right now, or it's just this. The more you dismiss these things, remember I said depression, anxiety, stress, all these things also end up with physical symptoms: low energy, feeling tired all the time, trouble sleeping or eating, or maybe now you're sleeping too much or eating too much, increased use of drugs or alcohol. You start to self medicate. Not all of it is conscious, right? You might not even realize you've started drinking way more. And that's why we have the mental health hour, because I hope you're listening to me and you're really assessing yourself. Like, where am I from what she's saying? How has it been for me the last 2 weeks? Right? You need to be assessing yourself, because a lot of these symptoms, and we don't make the connection sometimes. You have back pain all the time and you're thinking like, maybe it's my mattress, and then you go buy a new mattress and still maybe you're thinking it's this. And like, don't explain it away and then do nothing. Even if you can offer a solid explanation of why you are stressed, why you are anxious, why you are depressed, the fact that this has been the condition of your mind, of your body, of your soul for 2 or so weeks means go and see the doctor. Why? The doctor will do a proper assessment, and they will do blood tests. They will look at your hormones. They will look at your iron levels and all of that. Some years ago, I had a client who had severe anxiety, and it wasn't because of some trauma or something like that in her life, but it was due to an iron deficiency. She had anemia, like very like bad anemia, and so she had anxiety. And that's why you should go to the doctor, because some of these things, it's not necessarily that you've been through something. Sometimes your body is lacking something, or something's not functioning the way it should. So when you go to the doctor, they can properly assess you, and then you can make an informed decision about your treatment, about your health. Okay? So the emotional symptoms, feeling sad, restless, difficulty concentrating, all of that. There's physical symptoms, low energy, unexplainable and even explainable aches and pains, chronic headaches, digestive problems, dizziness, high heart palpitations, so increased heart rates. Maybe you're sweating a lot more and you're like, all the time I'm sweating. And then there's some of that self-destructive behavior, increased use of drugs and alcohol, and like I said, increased risky behavior. And that is often attached to addiction, right? But not exclusively so. My point is, some of the self-destructive behavior, it's not that a person is addicted, it's that they're depressed. Depression can lead people to do like crazy things that you're like, what is going on, right? They're driving at high speeds. They are taking worse and worse risks. And the problem with that is we're just looking at some of these things and we're not making the connection between that behavior and depression. So those feelings of loss of control, but also in your behavior, uncontrolled anger and rage. So that emotional dysregulation. Like 1 minute you're laughing, next thing you're lashing out. And people are now afraid to be around you. They feel like they have to, they're stepping on eggshells. They have to beat around the bush about a lot of things. And people start avoiding you because you've become volatile. Some of it is anger management issues, but it could also be depression. It could also be anxiety. It could also be stress. It could also be other mental health conditions. That's why you need to go to the doctor so you can figure out what exactly it is and address it head on. So, depression, like I said, can look different in different people, sometimes culturally, right? So, for example, I've heard so many Black folks, so many Black people say there's no such thing as depression in Africa or in the Caribbean. And I'm looking at them like, so are there no people? Obviously, there's people on those continents, and where there's people, there's depression. I think some time ago I shared some of the statistics. But because culturally there are certain and they we can look at this as both positive and negative. Positive in that it keeps us going. So if you come from a culture where there's no such thing as depression, and people will look at you being depressed as you're lazy, you're this and that alone keeps you going to work, keeps you going to school, keeps you productive. It can be both a positive thing, but it's also negative in that if people are not understanding that depression is a very real thing, it's not a white people disease, it's not a Western thing. Black people get depressed too. Black people also have anxiety. Black people also have addiction and sex addiction and food addictions and all of these things, right? Culturally, okay, let's give this example, food addiction. In some cultures, the fatter you are, the sexier you are, right? This being skinny like a reed is a Western thing. In Africa, it shows that you're doing well in life if you're thick, if you're fat, right? So we don't actually think of somebody's eating as, okay, this is not okay. There's some food addiction going on. There's some kind of eating disorder going on. We don't think about eating disorder in some of our cultures. Same thing with drinking. We have normalized in some communities men drinking so much that they stumble home or end up in a ditch somewhere. It's just him being a man. No, that's not what that is. So some things we have normalized to the point that we're not seeing the problems until it becomes a crisis, until it becomes trauma within our families. So, depression in a lot of families, communities, and all of that, people just deny it exists. And so, if you're depressed, maybe you just keep it to yourself, you're not saying anything. Suicide rates in Africa are rising, especially amongst young people and especially amongst men, right? Young men, high rates of suicide amongst young African men, higher rates of addiction across the board, men and women, young and old. But we're seeing younger and younger Africans dependent on drugs and alcohol. These are very real problems in our communities. I'm saying Africa, but it's the same thing in the Caribbean as well. And it's the same thing here in Canada and probably wherever you are listening to me right now, it's probably an issue. Why? Because in some communities, there's no supports. In others, there's absolute denial. What do you mean that you're depressed? Please, Black people don't get depressed. What are you talking about? Oh, that one, she's just lazy. or her mother didn't teach her how to wash herself because she's gone 2 weeks without showering because of the depression. So somehow it's that the mother didn't teach them hygiene. So our cultures are both protective, but they can also make the problem worse, because the more we look at these things with these narrow lenses, people don't get help. People don't get help. So the point of the mental health hour is that we have these discussions, we talk about these things, and this is not to dismiss our cultures. I'm a very proud person in terms of my culture. I love it, I enjoy it. But there are also some things that we need to admit our cultures are not helping. I was talking today about intimate partner violence at work, and how in some of us, our cultures, the most important thing is protect the marriage. Or you're saying he's beating you every night, but you can't destroy your marriage. Okay, so you end up protecting your marriage, but you die in that marriage. So really, what's more important, the marriage or the person's life? But culturally, we tend to want to protect the marriage at every cost. And sometimes that cost is a person's life. And this is why we also find when a woman finally leaves for their safety, the man feels entitled to go after her and kill her because how dare you leave me? So, some of these things in our cultures we really need to talk about from the perspective of we want more safety, we want to be healthier, we want to be more aware and educated around our mental health, around our physical health. And depression is something that we really, really, really need to, as different communities, wherever we are in the world, we really need to talk about it. We need to understand it. And we need effective strategies to prevent and to treat. If you are a parent, and I've said this and I'll keep saying it, and you're seeing certain things about your child that is not what they were normally like. They've suddenly become very moody. They're suddenly isolating. They seem sad. They seem very angry too. And some of these things we dismiss while it's just teenage behavior, while it's just teenage behavior. And so we dismiss, but they actually are suffering and they don't know how to get help. And when they hear these dismissive comments and all of that, they feel ashamed and worthless. So they keep it to themselves. And some weeks ago, or a couple of months ago, I shared the rates of suicide, even amongst young people. And we know that they are rising. They are rising because people are carrying things that they dare not share because they're afraid of the repercussions, they're afraid of being censored, they're afraid of being punished, even they're afraid of being mocked and laughed at. So when we talk about mental health, every time we talk about mental health, sooner or later that word stigma comes up. And that is what stigma is. It's saying to people, you have no right to feel depressed. Absolutely, no one has a right to feel depressed. Depression is not a right, it's a sickness. And it's a sickness that requires treatment, that requires understanding, that requires awareness. And we need to do that work in our communities. We need to do that work in our families as well. Like, talk to your children. Tell them if you find yourself feeling sad and you just can't shake it, come and let me know. Come tell me what it is. Sometimes we were talking at work about, I think it's almost 4 weeks ago, I bought mangoes, right? I went to the grocery store, I bought a bunch of mangoes. And I tried the first one. It was absolutely tasteless. Like when you look at it, it looks beautiful. You're thinking I'm in for a treat. There was absolutely no taste to this thing. And I tell you, 4 weeks later, it is not soft. It is still the same as it was when I bought it. It's still firm. How does that happen? How is that a real mango? Why am I bringing this up? Even the food we're eating is no longer healthy. And that can have an impact on our physical and mental health. We encourage children, people generally eat more fruit, eat more veggies. But when the fruit itself is some kind of alien, people are getting sick. And some of that sickness is mental. Some of it is your mental health is impacted by your diet. That's why, even as a therapist, I'm not a nutritionist, I'm not a dietitian, I'm not a physician, but I do talk to my clients about nutrition because it plays a part. When you're on medication, some medications will tell you don't take with food. Some medications will tell you take an hour after food. Some they say take with food, because food is an important part of our health. And these are mental or psychiatric drugs or psychotropic drugs I'm talking about, that they will tell you how to with certain foods. And then some they're like, don't, like I gave the example of coffee. You can't be on something that's supposed to calm you down and you're drinking 6 cups of coffee. Like that's just sabotaging yourself. It's counterproductive, it's counterintuitive. So my point is, we need to educate ourselves, our families, our communities on these mental health conditions: stress, anxiety, depression, the whole lot. And to do away with the judgments that make people feel too ashamed and guilty to seek help. Okay. We have a message here from a listener in Halifax who says, "Hi, Dr. Tapo. Thank you for this program. It's my first time here." Well, welcome to our listener in Halifax. It's great to have you. And like I keep saying to people, send us your texts, send us your messages, 437-778-3299, 437-778-3299, or email infolovebay@gmail.com. And if there are certain topics as well, say you've been to the doctor and the doctor told you you have some kind of, maybe it's bipolar, maybe it's anxiety disorder, maybe it's antisocial personality disorder, or one of the many personality disorders. Women, for example, I'll tell you this: Black women are more likely to be diagnosed with borderline personality disorder than any other demographic. If you are a Black woman and you've been diagnosed with borderline personality disorder, let us know, 437-778-3299. Or if whoever you are and you're out there, you're listening and you recently had a diagnosis, maybe you have some questions around that. Maybe you want to share like what you've been doing in terms of treatment. Last week, one of the things I said is, you can turn down the meds. You can say to your doctor, no, thanks, I don't want to take those medications. I'm just going to try some things. And you can ask your doctor, before I take the meds, is there anything else I can try? Lifestyle changes. And one of the simplest things is make sure you're getting enough sleep. Make sure you're eating healthy. Make sure you're exercising. Make sure you're socializing. Right? These are things that actually can make a difference. Because if you're depressed and you're isolating and always by yourself, that means all that is surrounding you are those negative thoughts. Sometimes, due to the depression, you just don't have the bandwidth, you don't have the energy to go out and socialize. And that's understandable. But try and push yourself, or try and see, okay, so maybe I can't go out, but maybe I can invite a friend or two and we can sit down and have dinner in my home, in the comfort of my own home. But don't isolate, because the more you do that, the worse it's going to get. People that are experiencing depression, one of the hardest things about it is those thoughts that keep going on and on and on and on in your mind, some of them suicidal, which when I was talking to you about suicide, that's what we call suicidal ideation. And so socializing and being other people around other people can, for whatever length of time, kind of pull you out of that, so you can have some rest and reprieve from those negative, harmful thoughts. Okay. So our time is up for today, Love Bay family. Thank you for listening in. Please get in touch, 437-778-3299. Email info, lovebay, LUVBAY @gmail.com. Have a wonderful rest of the day or evening, depending on where you are in the world. Enjoy the rest of this month of October, the rest of 2024. Be good to yourself, be good to your loved ones, be kind and compassionate in whatever you do. Good night.